go to the online presentation by Putu, Hadi, Purnama, Yati, and Abdullahi, Kawu. The presentation will build on this and will really identify how were these broad ideas about Africa Health Data Space, about European Health Data Space, how were they translated to a framework for VODAN-Africa. Putu was my student, my master's student, one of my master's students who did his, very early on, his thesis on translating fair data as a concept for the Indonesian data integration policy that the Indonesian government had put in place. And he was looking at this through the lens of fair data. And then he has gone on from Indonesia to be one of the front runners to bring together the whole VODAN-Africa community. I'm very proud of the work that Putu has done. Jeroen said, you know, one of the cornerstones why VODAN works is, well, one, it always operationalizes, put things in practice, not just abstract ideas, but test it. That is one. And secondly, to build trust. And so the task of Putu was, on the one hand, to make sure that this data sovereignty, this regulatory framework, through a federated lens and data ownership in the place where data is produced, that would translate in a regulatory framework that would both recognize the GDPR, the European GDPR, since we are across Europe, Africa, and Asia conglomeration, as well as the national, regional, local, in-hospital regulatory framework that hospitals would need to adhere to. And so in order to do that, he combined very high level of conceptualization of regulatory frameworks as they were developing, and really in-depth knowledge of the regulatory framework and the considerations, the concerns, also the ethical discussions within each place, each health facility where data was produced. And then I'm also very proud to introduce Abdullahi Kawu. He is one of the front runners, PhDs from our Nigeria team, and he has received a scholarship from Dublin. He works with the Technical University in Dublin and the team. They're very close colleagues, and they have been involved in one of the use cases around elderly care, in fact, in the Netherlands and Ireland, that is being conducted, and where Lars is the supervisor of that team. So with that, I hand over to you, Putu, and Abdullahi. Welcome.
Hi, everyone. Abdullahi and I will present on VODAN-Africa personal data protection and data production opportunities and challenges. And there are two parts of this presentation. So I will talk about data protection and then followed by Abdullahi to talk about the data production opportunities and challenges. Next slide, Abdullahi. Yeah, actually, I don't want to explain in details, but I want to summarize in a concise way. So basically, from 2020 until 2024, here is the timeline of our data privacy and protection progress. So first, the concept of data access and control, it was published in 2020. So I wrote this with the other authors about data access and control concept, and it explained about how fair data will be adopted in VODAN-Africa, and how the data scientists and how there is a framework about how data scientists will access the data, and also how is the researcher access the data, and how the others stakeholder research access the data. So that is basically our fundamental publication to move about the data protection and privacy in VODAN-Africa. And then in 2021, we did a preparation survey, and also preparation survey is about to know about the current situation on the health facilities, about the condition of data production, and also what is their awareness on the regulation or policy on the data privacy and protection. And then we have agreement on template for the health facilities, and also we agree on data processing agreement, because this is the one of the requirement of GDPR, but we still don't know about what is the Data Protection Act in each country. So then in 2022, I did the privacy assessment and GDPR report, helped by Abdullahi, Dr. Ibrahim, Getu, and Mariam. So we listing basically this is the risk assessment of the system, and also we explain about on how the data protection risk assessment. And then in 2023, we did the survey on challenge and opportunities of data pipeline, but the most important thing, we are aware on the challenge of domestic regulation, because such as in Kenya, the Data Protection Act was published in 2021, but in 2022, the government is require the organization that collect and process data should be registered in Data Protection Authority. And also now in Kenya, the patient data collection is getting I mean, like the protection of data patient is getting serious highlight by the government. So this is what is the current situation in 2023. And in the next for the next year, we will research about the understanding of data privacy preserving and data protection provision among the key stakeholder in VODAN-Africa. So I think that's all that I can report to you about the data protection and privacy timeline and progress from the 2020 until 2024. So I think Abdullahi will continue the presentation. So back to you, Abdullahi.
So yeah, so following on what Putu has presented on the journey around data protection, data production, we had an investigation in 2023 to look at the opportunities, but also the challenges to data production. So I probably, we are aware of the journey of the VODAN project as the case is, and how from 2021, 2022, we have had the technology in those countries. But of course, with implementation of the project comes both new opportunities, but also challenges. And that's what this investigation sought to understand. We did this with 20 country coordinators and data stewards from Nigeria, Kenya, Ethiopia, Somalia, and Uganda over a session that lasts between 45 to 60 minutes. We had interviews, and these were analyzed. And some of the feedback we got from that process was that the capacity building pillar of the VODAN project has been found to be very effective. Participants indeed find it very valuable, and that they indeed rated it quite high. They report that continuous professional development has been a problem or a challenge in many of the facilities. And so this is sort of a breather in that regard, but also that they do identify that there's need for continuous and increased support for such training to keep up with the pace of development, and even the new features that the software technology will come up with. So a key challenge that was reported was the issue of internet. We know these are low resource settings where there are fewer number of hours in terms of availability of both electricity, but also the cost of internet and the availability in those facilities was reported as major challenges. And as part of what we sought to identify is to identify how in their existing community as well as facilities, how do they navigate these challenges? And indeed, we find a lot in terms of even the kind of number of hours that electricity is available in those facilities and how that is maximally utilized in the context of this project, but against even the whole health facility workflow. And some of the, for instance, workaround around electricity include the use of the UPS system.
Just to keep a little bit on the main line of the story.
Okay, so the challenges like we have identified from this include system memory limitations, or it relating to documentation, but also speed. And there were very valuable suggestions that came through for future improvement of the technology to include the user interface, but also customization to fit what some of the participants reported as a good to have on the system. We also identified that many of them have made reference to some of the software they are used to and how it will be very helpful if the technology can be made very close to that and made easy to use. Thank you. That's about the presentation from me.
Excellent. Thank you so much, Putu and Abdullahi.